So good morning, everyone. Hope you are doing well. In today's session, I'm going to cover another 15 question themes from the Specialty and European Board exams of 2021 and 2022. This is a recall from the past exams. This is a continuation to my previous sessions of part 1 and part 2, where I had covered around 20 themes. And of course, you're aware that I have a session of around 30 question themes from the SCE 2023 exam and around 30 question themes from the 2024 exam as well. I'll be coming up with another session of the 2024 exam recall for another 30 questions in my next session. So this is all part of my lecture series. In all, there are a total of 84 lectures, including this one now. And it covers across the different topics which are commonly tested in the specialty and the European board exams. So hope you like this session as well. And let's start right away. So question theme 1, a patient with bariatric surgery present with renal stones. What is the possible cause? Answer is hyperoxaluria. So RBGY has been linked to metabolic changes that can alter the urine chemistry profiles, and this can result in a higher calcium oxalate supersaturation and urinary oxalate. It can also lead to a lower citrate and lower urine volume. And that's why there is a risk that these patients with RYGB or RNY gastric bypass can develop nephrolithiasis that can lead to hyperoxaluria. So while uncommon, the increased absorption of calcium oxalate can also lead to deposition in the renal parenchyma, resulting in oxalate nephropathy and renal failure. So that's can happen with patients with bariatric surgery and the cause of recurrent renal stones in this scenario. So this was tested in the previous exam. Second case scenario, we have a pregnant female who is hyperthyroid, thyrotoxic. Her TRAP antibody is positive, and she is 9 weeks pregnant. What is the next step? So the drug of choice here is propylthiouracil. So the choice of thiamine if the patient is diagnosed prior to pregnancy. So for women diagnosed with Graves' disease prior to pregnancy and who are taking methimazole, elect to have a definitive therapy with surgery or radioiodine, ideally prior to pregnancy. So this is what is recommended. Switch to propylthiouracil before trying to conceive, especially in context of younger women with normal periods. And we should switch to PTU as soon as pregnancy test is confirmed, especially in such case scenario, if it is diagnosed in the first trimester. So clearly diagnosed during the first trimester, go for propylthiouracil. Patient may continue to use PTU for the remainder of pregnancy or switch back to methimazole at 16 weeks. And if it is diagnosed after first trimester, the drug of choice as recommended by the guidelines is methimazole. So in this context, PTU, the drug of choice for a 9-week pregnant woman with Graves' disease. Case scenario, McCune-Albright syndrome, and then asked for what is a possible lesion in the thyroid. The most common in this context is a functioning adenoma. As you can see from this chart, which is given in Oxford Handbook, it helps us know the different endocrinopathies in McCune-Albright syndrome. If we look per se for the thyroid nodules, these are present in almost around 50% of the patients, and they are functional, usually functioning nodules, and they clearly have evidence of thyrotoxicosis due to the raised deiodinase activity. The other endocrinopathies which we should be aware of is precocious puberty, growth hormone secreting pituitary tumors and prolactinomas, neonatal hypercortisolism, and hypophosphatemic rickets. All these are very important to be aware of when we talk about different endocrinopathies in McCune-Albright syndrome, one of the exam favorites in terms of SCE and European board. Let's move on to the next slide. Question case scenario 4, they asked about metformin in context of a type 2 diabetic patient. At what EGFR should it be stopped? Correct answer is less than 30 ml per minute per 1.73 meter square. This should not be used or should be stopped when EGFR is less than 30. Lactic acidosis rarely occurs, usually in context of acute kidney injury. Therefore, patients should be advised to temporarily stop metformin during acute severe illnesses, dehydration, and vomiting, and for 48 hours after an iodinated contrast imaging scan. So, right answer there, less than 30. So, this was a question, and they had asked for which one of the following is an orexigenic agent. So the correct answer was ghrelin. So what is an orexigenic agent? It is an appetite stimulant. It is a drug or a hormone or a compound that can increase appetite and can induce hyperphagia. So ghrelin, a hunger hormone, rises before and probably is involved with the initiation of the food intake. Satiety hormones released after food include GLP-1, incretin hormone secreted by ideal L cells in the distal intestine that stimulate insulin secretion, and peptide Y secreted from ileum and colon. So these are all satiety hormones. Ghrelin is an hunger hormone. Oxyntomodulin, also derived from pre-pro-glucagon, reduces the food intake and increases the energy expenditure after systemic administration. So this is another thing which we should keep in mind. However, the correct answer in this context for an orexigenic agent was ghrelin. Question theme 6. We have an Asian woman presented at 28 weeks of gestation. What will you advise for her? So offer her an OGTT. This comes from the NICE guidelines, which were last updated in 2020, dealing with diabetes in pregnancy, management from preconception to postnatal period. We should assess the risk of GDM using risk factors in a healthy population. At the booking appointment, check for the following risk factors. Does the patient have BMI above 30? If the patient has history of previous macroscopic baby of weight more than 4.5 kg or more, previous GDM, family history of diabetes, especially first degree related with diabetes, and an ethnicity with the high prevalence of diabetes, like an Asian ethnicity in this context. So, in this context, we should offer the patient a 75-gram 2-hour GTT to test for gestational diabetes in women with risk factors, like our patient who has Asian ethnicity. For women who have had gestational diabetes in the previous pregnancy, we should offer early set monitoring of blood glucose or a OGTT, 75-gram 2-hour OGTT, as soon as possible after booking, whether it is in the first trimester or second trimester, and a further 75-gram 2-hour OGTT at 24 to 28 weeks if the first OGTT results were normal. And offer women with any other risk factors of GDM, as we can see the other risk factors, a 75-gram 2-hour OGTT at 24 to 28 weeks. So the correct answer in this context with Asian ethnicity, offer OGTT at 24 to 28 weeks. So the correct answer here was offer an oral glucose tolerance test. Question theme 7, case scenario for Turner's syndrome. Oophorectomy is recommended in which chromosomal abnormality of Turner's? Correct answer was 46XY. This is a good chart from Oxford Handbook correlating the karyotype with the phenotype. So 45XO, of course, is the most severe phenotype. There is a high incidence of cardiac and renal abnormalities. In 46XI, there is increased prevalence of thyroiditis, IBD, and deafness. In 46X R, there is spontaneous menses in 33%, with congenital anomalies being uncommon, and cognitive dysfunction can occur in those with a small ring chromosome. And in those with 46XY, as was the correct answer in this question, there is a very high risk of gonadoblastoma, and hence they recommend gonadectomy or basically oophorectomy. So, question 8, theme 8 is which of the following is the best indicator of active Graves' orbitopathy? So, the answer lies in the UGOGO clinical practice guidelines, and the correct answer from the options given was pain on upward or downward gaze. So, this is from the UGOGO guidelines. CAS of less than 3 is inactive graves of thermopathy, and CAS of more than or equal to 3 is active graves of thermopathy. Assessment of activity depends upon the following points: spontaneous retrobulbar pain, pain on attempted upward or downward gaze, as was the answer in this question, the redness of eyelids, redness of conjunctiva, swelling of caruncle or plica, swelling of eyelids, and swelling of the conjunctiva or chemosis. In addition to this, a total of 10 item CAS is there, which also includes an increase in the exophthalmos of more than or equal to 2 millimeter, a decrease in the eye motility of greater than or equal to 8 degree, or a decrease in the visual acuity in the last 1 to 3 months is all useful to assess the progression of Graves' ophthalmopathy after the first visit. Again, I have a very detailed session on Graves' eye disease. Please do listen to that lecture. That will be very helpful for your exams and clinical practice. Moving on to question theme 9, well, the answer is obvious here. The flu-like reaction is the most common side effect of zoledronic acid. These are the drugs like bisphosphonates or drugs which act by inhibiting the enzyme farnesyl pyrophosphate synthase and inhibiting the osteoclast. Hence, there is a reduction in bone turnover and bone loss is prevented. Again, they have asked several times this mechanism of action of bisphosphonates. Oral preparations require patients to follow strict dosing instructions, should be taken in empty stomach, and at least 30 to 60 minutes should pass prior to additional oral intake. Otherwise, GI disturbances and nausea, esophagitis are very common. Flu-like symptoms occur in 20 to 30% of patients following IV administration of zoledronic acid, as was the answer in the scenario. And this is basically an acute phase response. So that is the commonest side effect of zoledronic acid. Rare, we can have osteonecrosis of the jaw. Also, there is association of atypical femoral fractures. Again, incidence is very low. Especially, it can happen if the treatment is extended beyond 5 years. Then, if treated for 5 years, consider therapeutic holiday. That is what is recommended for the bisphosphonates, unless T score is worse than less than 2.5 at the end, at the hips, or with the existing history of vertebral fractures. So, and that's the end of my preview. The total themes, question themes in this particular session is 15. If you like to access for the full session, please subscribe to my lecture series. You can simply get in touch with me through my email ID or WhatsApp me on the number 00971557434794. I wish you all the best for the upcoming specialty certificate exam, which is there in the next 3 days, and the European board exam, which is coming up in December. Thank you so much.